Have you ever wondered what your doctor really thinks when you walk into the exam room? It's not something most people like to imagine, but behind the polite smile and professional tone, some doctors hold unspoken beliefs about older patients that can influence the kind of care they receive. These opinions aren't always favorable and are rarely said out loud. Still, they can directly affect how seriously your symptoms are taken, how your treatment is planned, and even which options are offered to you. In this video, we're going to gently uncover 5 revealing truths about what many doctors may actually think about older adults. Understanding them is the first step toward making sure you receive the respect and care you deserve in any medical setting. Stay with me until the end, because the final truth could completely change how you approach your next appointment. Let's begin. Number 1. They often assume most symptoms are just age. One of the most frustrating experiences many older adults face is when doctors quickly attribute their symptoms to the natural process of aging. You might mention joint pain, fatigue, or memory changes, and the response could be something like, "Well, that's normal at your age." While aging does bring certain changes, this assumption can lead to missed diagnoses and delayed treatment for real treatable conditions. The danger is that once a symptom is labeled as age-related, the urgency to investigate disappears. Shortness of breath may be dismissed as simply slowing down, when it could actually be an early sign of heart disease. Occasional forgetfulness might be brushed off as a senior moment, even though it could be linked to a medication side effect or a thyroid issue, both of which are treatable. By assuming age is the explanation, opportunities for prevention and recovery are lost. This mindset doesn't always come from bad intentions. Many doctors are under pressure, seeing many patients in very little time. When they hear a common complaint from an older person, it's tempting to choose the simplest explanation, but simple isn't always correct. Treatable conditions like depression, vitamin deficiencies, or early-stage cancers can be overlooked this way, leaving people to suffer longer than necessary. I once met an 82-year-old man named Robert who began experiencing extreme fatigue and occasional dizziness. His doctor initially dismissed it as slowing down with age and advised him to rest more. Months later, after Robert insisted on further testing, they discovered a heart valve problem that could be corrected. After treatment, his energy returned, and he often said he wished someone had taken his early complaints seriously. It's essential for older adults to remember this. Aging is not a universal explanation for every ache, discomfort, or health change. Yes, the body changes over time, but those changes deserve careful evaluation, not dismissal. A persistent cough, unexplained weight loss, or sudden mobility changes deserve thorough investigation at any age. When doctors look beyond age-based assumptions, they often uncover treatable problems that improve both quality of life and longevity. As a patient, speak clearly, ask questions, and make it known that you want answers, not just reassurance that this is normal for your age. You deserve the same level of medical rigor as someone decades younger because your health matters just as much at 80 as it does at 40. Number 2. They may believe older patients are less likely to follow treatment plans. Another unspoken reality is that some doctors assume older patients won't follow or won't be able to follow medical instructions as carefully as younger ones. This perception often comes from stereotypes, past experiences, or unconscious bias. If a doctor believes you'll struggle to follow a plan, they may simplify it in ways that don't truly benefit your health, or avoid offering more comprehensive options altogether. Even if the intention is to make care easier, the result can be less thorough treatment than you deserve. This belief often stems from concerns about memory, hearing, or managing multiple medications. A doctor might think, "If I give too many details, they'll forget," or "This regimen will be too complicated." While some older adults do face challenges in these areas, it's a mistake to assume it applies to everyone. Many people in their 70s and 80s are perfectly capable of following detailed instructions, managing medications, and researching their conditions to make informed decisions. When a doctor withholds full explanations or options, you lose the chance to choose what might help you most. A specialist might skip mentioning an advanced arthritis therapy because they assume you won't want to deal with extra steps, even if you're willing and able. Or they may fail to explain how lifestyle changes, alongside medication, could better control your blood pressure. In both cases, you're left without the full picture. I once spoke with Carol, a 79-year-old woman diagnosed with a heart condition. Her first cardiologist gave her a very basic plan, assuming she wouldn't want anything demanding. But Carol wanted to be proactive. With a new doctor who explained all her options, medication combinations, diet, and exercise, she managed her condition far more effectively. That's why it's so important to show your doctor that you're engaged and willing to participate. Bring a notebook to appointments, ask for written instructions, and don't hesitate to request clarification if something isn't clear. By demonstrating that you can and will follow through, you help break the assumption that older adults can't manage complex care. In the end, adherence to treatment isn't about age. It's about motivation, support, and clear communication. When doctors see your commitment, they're more likely to share all available options, giving you the best chance at good health and quality of life. If you're still watching and these reflections resonate with you, please comment number 2 below so I know you're here. And if you haven't subscribed yet, I warmly invite you to do so and activate the notification bell. Your support allows us to keep creating content that informs and inspires. Number 3, they may prioritize younger patients in certain situations. This is an uncomfortable truth, but in some cases, doctors may, without realizing it, give more urgency or attention to younger patients, especially when time and resources are limited. This bias doesn't always come from disrespect. It can stem from the belief that younger people have more years ahead of them and therefore more to gain from aggressive treatment. For older adults, however, this can mean less urgency, fewer follow-ups, or being overlooked for procedures that could still offer meaningful benefits. In busy clinics or hospitals, a doctor may instinctively spend more time with someone 20 or 30 years younger, thinking the long-term impact will be greater. The problem is that this ignores the immense value of improving quality of life at any age. A 75-year-old deserves the same chance to feel strong, capable, and pain-free as a 40-year-old. This bias can appear in testing. An older patient might be told a test isn't necessary because symptoms are normal for age, while a younger patient with the same symptoms is evaluated immediately. It can also show up in surgical recommendations, where a doctor avoids suggesting a procedure because they assume recovery would be too difficult, without asking if you're willing to take on that challenge. I remember Richard, an 82-year-old man suffering from severe knee pain. His first doctor dismissed joint replacement as too much for his age. Richard, active and determined to stay that way, sought a second opinion. The new surgeon evaluated his actual health, not just his birth date. Richard had the surgery, recovered well, and returned to the daily walks he had missed for years. Age should be one factor in decisions, not the deciding one. Your overall health, mindset, and personal goals matter just as much. If you feel sidelined or less prioritized than younger patients, it's okay to speak up or seek another opinion. By reminding doctors that you value your comfort, your time, and your future, you shift the conversation from how long you might live to how well you can live, and that shift can make all the difference in the care you receive. Number 4, they may view your life goals as less important. Another hidden assumption some doctors make, often unconsciously, is that in your 70s or 80s, your priorities are limited to comfort and basic maintenance, rather than pursuing goals, hobbies, or new experiences. This mindset can quietly influence the advice and treatment they offer. If they believe your main goal is simply to get by, they may focus only on symptom control instead of exploring options that help you stay active, travel, or enjoy what you love. For example, with knee pain, they might emphasize medication rather than surgery or physical therapy that could allow you to walk, dance, or garden again. Or they may suggest the quickest, easiest treatment instead of a proactive approach that requires more effort but offers greater long-term benefit. This way of thinking can be especially limiting if you still have vibrant goals. I met Helen, an 81-year-old woman who dreamed of visiting her granddaughter overseas despite having a chronic lung condition. Her first doctor suggested focusing on comfort at home. But Helen wanted more than comfort. She wanted to travel. With a new doctor who listened to her goals, they created a targeted plan: exercise, updated medication, and travel preparation. 6 months later, she made the trip and said it was one of the happiest moments of her life. Your goals matter at any age, whether it's gardening, joining a group, or taking a special trip. Your medical care should support those ambitions. If your doctor doesn't ask about your life beyond basic health, Bring it up yourself. Share what you hope to achieve and ask how treatment can help you get there. When doctors see you as a whole person with dreams and plans, not just someone to keep stable, they can tailor recommendations that truly make a difference, helping you live not just longer, but better. If this resonates with you, please comment number 4 below. And if you haven't subscribed yet, I warmly invite you to do so and turn on notifications. Your support helps us continue creating content that informs and inspires. Number 5. They may underestimate the emotional impact of aging on health. While many doctors focus intensely on physical symptoms, some underestimate how much emotional well-being influences overall health, especially in older adults. Aging isn't just about joints, blood pressure, or lab results. It's also about adapting to loss, changes in identity, and sometimes reduced independence. When the emotional side is ignored, treatment plans can feel incomplete, and important needs go unmet. Sadness, anxiety, or withdrawal may be dismissed as just aging, instead of recognized as issues that can and should be addressed. Doctors may not ask about loneliness, grief, or fears because it's not on the standard checklist, but these emotional factors directly affect physical health, influencing sleep, appetite, immunity, and recovery. I spoke with Leonard, who lost his wife after 54 years together. His health declined rapidly afterward, yet every visit focused solely on adjusting medications. No one asked how he was coping or whether he had support at home. Only when a neighbor suggested counseling did Leonard begin to feel like himself again, and his physical health improved as well. Not because of a new prescription, but because the emotional burden he carried was finally addressed. Emotional struggles in older adults can be harder to detect, especially if you automatically say, "I'm fine." That's why it's important to share what's really going on, even if it seems unrelated to your medical condition. Telling your doctor you feel low, stressed, or lonely isn't complaining. It's providing the full picture they need to help you. When emotional health is acknowledged and addressed, it often leads to better outcomes, more energy, and a stronger sense of purpose. A good doctor understands that treating you as a whole person means caring for both body and mind. Sometimes a single honest conversation can be just as important as any prescription. Final reflections. Hearing these truths can stir many emotions. Some may nod because they've experienced them firsthand, while others may feel frustrated or even hurt. But the purpose of sharing this isn't to paint all doctors with the same brush or to make you lose trust in them. It's to remind you that your health and dignity deserve to be fully seen, respected, and cared for at every stage of life. Understanding these realities can help you enter appointments with greater confidence. Ask the right questions and make sure your voice is heard. Aging does not make you less important. Your experiences, wisdom, and resilience are things no test can measure, yet they are essential to who you are. You have the right to expect care that treats you as a whole person, not just a set of symptoms or a date of birth on a chart. And if you ever feel overlooked or dismissed, that's not a sign to give up. It's a sign to speak up, seek a second opinion, or find a professional who values you as the unique individual you are. Over the years, I've learned that the best outcomes in medicine often happen when patients and doctors work as a team. That means being honest about your concerns, asking for explanations when you don't understand something, and remembering that you are an active participant in your care, not a passive recipient. Take this knowledge with you. Let it guide you towards stronger, more respectful relationships with those who care for your health. And never forget, your life, your story, and your well-being matter just as much today as they did decades ago. Thank you for being with us today. We'd love to hear from you. Leave a comment sharing one thing you learned and how you plan to use it in your life. Your words matter to us more than you might imagine. And if you found this video helpful, please like it, subscribe, and share it with someone who might need these gentle reflections. Thanks for watching. See you in the next video.